Good morning, everybody, and thank you for participating in ProA's Trauma-Informed Care and understanding how it benefits those working with individuals dealing with addiction and recovery. Just some housekeeping items real quick. In the top right-hand corner of your screen, you should see a lengthwise toolbar. That is where you will be able to raise your hand. If it indicates that your hand is down, it will often show on my screen that your hand is up. So please be aware if you are asking questions to allow time for response. If questions could be held until the end, we will have time for question and answer. And anybody who is interested in having this webinar done at a later time, we will be posting this on our website and you will be able to go back in and review at a later date. Okay. So let's get into why trauma-informed care is important when working with individuals who are facing or dealing with recovery. In today's webinar, we are going to be covering what the individual is hoping to gain, what trauma-informed care is, what the trauma approach is. And give me a second, my slides are frozen here. Okay, there we go. So in today's webinar, what we will be looking for is to gain a better understanding of what trauma is, the trauma-informed theory, the effects of trauma on children, adolescents, and adults. We'll gain a brief overview of the diagnosing criteria for post-traumatic stress disorder. We'll gain insight into what trauma-informed care approach is, the benefits of trauma-informed care in working with those in addiction recovery, what it means to be in recovery from both addiction and trauma, how to best support someone in addiction recovery who is also dealing with a history of trauma, what is compassion fatigue, and how to identify symptoms of, learn to cope with, and prevent compassion fatigue. So why is it important to acknowledge trauma? If you understand that addicts are wounded people, then you may experience the following benefits. You'll gain a different perspective. When you understand the depths of someone's wounds, then you can see them from a different perspective. Rather than seeing them as a selfish, self-centered drug user who is completely oblivious to the pain they are causing, you can see them as a hurting person who is using drugs to numb their pain. They're not trying to cause pain, but rather escape it. We develop greater patience. Seeing an addict as a wounded person can yield an extra measure of grace when someone makes mistakes. Understanding a person's history or current situation may elicit empathy, which helps you resist the temptation to lash out in frustration. And we develop stronger empathy. You may have had a judgmental attitude towards addicts before knowing that addicts are wounded people. You may have thought addicts had poor self-control or that they lack moral fiber. However, seeing an addict's wounds occur may force you to recognize those same wounds in your own life. You can readily relate to drug users if you have been on similar paths. Being able to see that a friend or loved one is using drugs to hide or avoid the pain that comes from deep wounds may help you be more willing to understand or be less judgmental. It affords you the opportunity to realize that all people share a desire to be loved and accepted. So what is trauma? The word trauma is used to describe experiences or situations that are emotionally painful and distressing, and that overwhelm people's ability to cope, leaving them powerless. Trauma has sometimes been defined in reference to circumstances that are outside the realm of normal human experience. Particular forms of trauma, such as intentional violence and/or witnessing violence, sustained discrimination, poverty, ensuing chaotic life conditions, are all directly related to chronic fear and anxiety, with serious long-term effects on health and other life outcomes. It's important to understand that no matter how small or insignificant a person's traumatic event may appear to you, it's very real to them. It is something that has significantly impacted their life and impaired their ability to function without serious long-term negative effects on their health and life. If a person has experienced a traumatic event, they are experiencing persistent symptoms such as recurring symptoms, that involve reliving the traumatic event, avoidance symptoms, which are efforts to avoid situations that may trigger memories of the traumatic event, numbing symptoms, as in some people may have a hard time being in touch with their feelings or express emotions towards people. Others may forget or be unable to talk about important parts of the event, while others may think they will have a shortened lifespan or will not reach personal goals such as having a career, family. And another symptom they may experience is the arousal symptom, where they may feel constantly on alert after a traumatic event, which can make it difficult to sleep, cause outbursts of anger or irritability, and difficulty concentrating. If someone's experiencing these symptoms at a level of intensity that is causing such significant distress that it interferes with work or home life, and these symptoms have been present for at least 1 month, this may be a reasonable cause to have a person evaluated for post-traumatic stress, and then follow up with some direct specialized treatment to help them learn how to cope and manage their symptoms. So what is the trauma theory? The trauma theory represents a fundamental shift in thinking from the idea that those who have experienced psychological trauma are either sick or deficient in moral character, to the reframe that they're injured and in need of healing. Psychic trauma occurs when a sudden, unexpected, overwhelming, intense emotional blow or a series of blows assaults the person from the outside. Traumatic events are external, but they quickly become incorporated into the mind. The trauma theory defines psychological trauma and helps us best understand what trauma does. It explains how it is not the actual trauma itself that does the damage, but rather the way the individual's mind and body reacts in its own personal matter to the traumatic experience. The trauma affects the entire person. All aspects of the individual's life are profoundly altered through the traumatic event. It affects how they think, how they learn, how they remember, their self-esteem, and views of others in the world around them. What are the benefits to understanding the trauma theory? By understanding the trauma theory, it allows us better opportunity to develop better insight into the fight or flight response. Allows us to understand what learned helplessness is, what the loss of volume control, how a person thinks under stress, how an individual remembers the stress, and further explains disassociation and its role as an individual's built-in safety valve. The trauma theory goes on to further explain insight into addiction to trauma, trauma bonding, trauma reenactment, and allows for a better understanding of how we can move from the role of victim to victimizer. We see that in oftentimes where a child has been victimized in their early years and later goes on to become a victimizer as they identify with that role. As part of the trauma theory, we can also develop a better understanding of the importance of creating a safe environment that will promote health, healing, learning, and growth. This is defined as creating sanctuary. What are the effects of trauma on children? Children who have been exposed to chronic trauma and stress process their experiences differently than children who have secure experiences. When a person experiences chronic stress or threat, their brain activates the fight or flight response by increasing the amount of hormone known as cortisol. While cortisol can be beneficial in emergency situations, it is adversely toxic during periods of chronic stress and can lead to damage or kill neurons in essential areas of the brain. In severe cases of chronic trauma, exposure causes a state of hyperarousal or disassociation. Some characteristics of hyperarousal are constant anxiety, increased heart rate, elevated body temperature. And disassociation is the internal response where the child shuts down or detaches as a means of self-preservation. This becomes their maladaptive tool for managing overwhelming emotions and/or situations. We've learned that children are also more likely to develop post-traumatic stress disorder as a result of their inability to neither fight or flight. These children enter a state of learned helplessness. Learned helplessness can permeate all stages of a child's development and drastically impact their ability to believe they are capable of living a life in a positive manner. In trauma, neglect happens in early childhood and is left untreated, the effects of their experiences will continue to infuse all developmental stages throughout their life. And what are the effects of trauma on adolescents? Adolescence is a time in which one brain undergoes a crucial restructuring, a reorganization process, often referred to as the use it or lose it phase. It's during this time that functions which are being most used and stimulated are hardwired into the brain, and any function that's not used, the brain sheds. The brain's restructuring takes place within the cortex, which is the highest functioning area of the brain required for planning, good judgment, and other crucial functions needed for adulthood. It's during the teenage years that we see the use of more basic, primal areas of the brain to manage emotions. As a result of the restructuring, we're more likely to see teenagers react as opposed to thinking things through, follow their initial response as opposed to reasoning, misinterpret body language, be more susceptible to stress, and require more sleep as a result of all the work their brain is doing in order to change. Adolescents also develop sexually before their brain is mature enough to handle this responsibility, and as a result, they find themselves more vulnerable to making unhealthy choices regarding sex and relationships, and place themselves in high-risk behavior situations such as drug or alcohol use. What are the effects of trauma on adults? The relationship between traumatic childhood experiences and the emotional and physical well-being of an individual through adulthood has been at the core of the milestone ACE study, which is the Adverse Childhood Experiences Study. The ACE study involved the participation of middle-aged Americans, over 17,000, with the average being 57. And focused on 9 areas of childhood abuse and dysfunction within the household: emotional or physical neglect, recurrent emotional abuse, recurrent physical abuse, an incarcerated household member who was chronically depressed, mentally ill, suicidal, or institutionalized, contact sexual abuse, alcohol and or drug abusers within the household, the mother being treated violently, one or no parents. A participant score on the ACE study reflects the number of above experiences they claim, as in if the participant were to score 2, that would indicate that the participant experienced 2 of the above ACE. There are 2 major findings that result from the ACE study. ACEs are much more common than originally anticipated or even recognized, even in the middle-class population studied, who received care through a large HMO, and ACEs carry a significant correlation to emotional and physical health outcomes later in life. The following are some risks associated with increased ACE scores: cognitive, social, and emotional impairments, increased health risk behaviors, disease, social problems, disabilities, and early death. So what is the trauma-informed care approach? SAMHSA has identified 6 key principles of the trauma-informed approach: safety, trustworthiness and transparency, peer support, collaboration, empowerment, and culture. The trauma-informed approach, consistent with SAMHSA's definition of recovery, promotes the connection of services and supports that are continually building on the best evidence available and develop ongoing engagement, collaboration, and empowerment for the individual as well as the family. How can a program or organization become trauma-informed. They become trauma-informed when they begin to realize that the widespread impact of trauma and understands the potential path for recovery in the individual's life, recognizing signs and symptoms of trauma in clients, families, staff, and other involved with the system. And they respond by fully integrating knowledge about trauma into policies, procedures, practices, and when they seek to actively resist re-traumatization. So what are the benefits of trauma-informed approach? When we use the trauma-informed approach, we tend to have the best information possible when we are looking to work with individuals who have experienced trauma, and how do we best suit them. We're able to match the specific needs of each individual on a continual basis as we use the most current information we have in developing our treatment plans for these individuals or developing resources and supports. So what does it mean to be in recovery from addiction? Recovery is a process of change through which individuals improve their health and wellness, live a self-directed life, and strive to reach their full potential. The definition is simple and designed to envelop all aspects of an addict's life. According to the working group that helped to create this new definition, there are 4 areas that support life in recovery: health, managing one's disease and live a healthy emotional, financial, and physical life; home, develop a safe and secure living environment; purpose, participation in day-to-day activities that help provide a sense of purpose, of accomplishment; and community, building friendship, having hope, love, and support. The worst thing for a person in recovery to do is isolate themselves. So what does it mean to be in recovery from addiction? Or trauma, excuse me. What it means to be in recovery from trauma is that one is able to live each day in the present without becoming overwhelmed by feelings and/or thoughts of past events. While recovery is the primary goal for those who have experienced trauma along with their families and caregivers, it does not mean that one shall be freed of their pain. Recovery from trauma, as it is also from addiction, is very individualized. No 2 recoveries will look, feel, or be the same. The first goal of trauma recovery should and must be to improve your quality of life on a daily basis. So how do we best support someone in recovery who's dealing with a trauma? The best thing that you can do when looking to develop a working relationship with an individual who has experienced trauma is develop yourself a trusting relationship. Having a trusting relationship is crucial when dealing with someone who suffered trauma. They need to know that the individual that they're working with truly has their best interest at heart and is not set out to re-victimize. What are some ways that we can establish a trusting relationship? Have quality interactions with the individual. This would mean fully engaging with them and listening to what they have to say. Don't make promises or commitments that you may not be able to fulfill or keep. Most individuals that we're looking to develop these trusting relationships with have had a lifetime before of broken promises, and that is something that becomes a red flag. So if someone notices that you're unable to keep commitments, they're not going to be giving you their best or trust in that matter. Involve them in decisions that affect their lives. Don't talk around them, talk to them. Figure out what it is that they want. How do they feel about the plans that are coming into place? What kind of supports do they think they need? Focus on their strengths and resiliencies. It's very easy to point out all the things that we do wrong, but it's much more empowering when we can point out all the strengths that we have and how we can build on tools that we already have and expand our ability to deal with situations and manage emotions. Set up relationships and situations that avoid re-traumatization. In that case, where you're going is if you know that an individual has a high response to older men, and a lot of the services provided or engagement includes older men, that might be an area that you need to hold off on until they are able to get in a more secure place and build on their strengths. When we introduce an area that might re-traumatize the individual, that also is a key that would reduce the trust in the relationship. Help them identify their triggers and develop ways to stay safe. Whether they know it or not, they know what's going to trigger them and set them off. Sometimes it helps having someone walk you through exploring what they are so that you can sound them out, hear how they affect you, and find a way to positively implement coping skills into your daily life. Again, we're going to focus on their strengths and what they can do. Ask them for suggestions about how they want to be helped. A lot of times we have very good ideas of what we think will help an individual, but we're not on the same page as the individual. There's nothing wrong with asking them, how do you see yourself being helped? What do you see working for you? And try it out. That makes it more possible. If you try something out that they suggest, you can go back and revisit at a later time and talk about how it was beneficial or how it wasn't as effective as it could have been. And what are some ways that we can find effective strategies to use on a daily basis? And one of the most important things that we can do when we're helping a traumatized person is manage our own trauma and stress. What is compassion fatigue? Compassion fatigue is a natural consequence of helping a traumatized individual. Compassion fatigue is often the result of empathy the helper and or caregiver feels towards working with the individual who has suffered the trauma. What are the symptoms of compassion fatigue? An individual that is experiencing compassion fatigue might have irritability, might find apathy, loss of motivation, feel fatigued, have feelings of being overwhelmed, loss of interest in things you once enjoyed, or have intrusive thoughts, especially pertaining to work. A lot of times the word burnout is used in comparison with compassion fatigue. Those of us in the helping profession, we may have experienced burnout. It is important to understand that while compassion fatigue and burnout may produce similar symptoms, they're very different from each other. Those who are truly burned out have lost their ability to empathize with the individuals they're working with. And those who are experiencing compassion fatigue want to help, empathize with those they're working with. However, they become so overwhelmed with their own feelings and thoughts in the process that they become ineffective. So how do we prevent and manage our symptoms of compassion fatigue, and how do we keep them from coming back? So preventing compassion fatigue, maintain a balance between your work life and your personal life. Have a balance. Have something that you enjoy doing. Have an outlet so that at the end of one of those days that's very stressful, you have something to bring you back in and you're able to remain empathetic towards the individual. Eating healthy is part of that. Incorporating exercise. Develop and maintain a good support network, because those are the people you'll lean on just as you are a support network for the individuals we're working with. And don't be afraid to experience and feel your own emotions, and never be afraid to laugh. How do we manage our compassion fatigue? Create a plan to begin inputting healthy behaviors. Develop and maintain healthy boundaries with individuals in your life as well as your work life. Never feel as though you can't ask for help, and use all the resources that you have available. That is the end of our presentation on trauma-informed care at this point. At this time, I will open it up for any questions anyone might have. Did somebody have their hand up? So the question is, how can we help a person who may need help with trauma? First and most importantly, when we're looking to help an individual that has worked through, it's coming through in parts. When we're looking to help someone with trauma, the first thing we want to do is take a listen to what they're feeling, how they're managing, observe what their stressors are, what they're letting you know their stressors are, through talking to them and seeing, one, the level of severity it's impacting their life would determine on how we would proceed from there. There are a multitude of treatments that will help an individual work through their trauma experience. What we would do is find a counselor, find a therapist if they're not already working with one. How do we best match them with the therapist to best fit their needs? Perhaps we need to incorporate mental health services if there's aspects of depression or anxiety that aren't successfully managed just through identifying triggers and utilizing coping skills. But we also would want to make sure that we are following up professionally and that they have the support professionally that they are comfortable with receiving. And it is important to know that oftentimes when people are beginning to understand that they are suffering from trauma, they may not be overwhelmingly excited about having to have professional intervention. Sometimes they feel that there's something wrong with them if they require, having to go to a psychologist or a psychiatrist. But that is something that we do encourage. If the individual is having a hard time working through their trauma, they do need to have assistance professionally to help walk them through. That is not something that we can do on our own. Let's see. Kelsey has a question. How do you distinguish between trauma experiences and addiction experiences when working with an individual? Is it best to help them work through these issues separately or together? A lot of times what we see is when we are dealing with an individual who has addiction or is facing addiction, and through the course of our work with that individual, maybe we know ahead of time that they have experienced a significant trauma, or we find out through our time working with them. The two recoveries are going to be separate, but there's going to be parts that are incorporated together. Without addressing the one, then the likelihood of having long-term success with the other isn't as significant as if we are addressing the whole picture. So it's a very holistic approach when we're facing a trauma history as well as addiction issues, because a lot of times what will happen is the individual, as they're not understanding that they're having trouble working through trauma, that is where they begin to cope with the unhealthy behaviors such as drug or alcohol use. So in that case, if you have an individual who is working through with their trauma, or trauma comes up in the course of working with an individual, you need to find out, one, what they're comfortable with. Again, we're going to listen to what they have to say and ask them what kind of feedback they want, or what kind of, assistance they want. And then we can further pursue it from there. If they feel that they are comfortable and you see progress being made with the work that we're doing on a one-on-one with them, then it's okay to monitor that. But The addiction will have to be addressed, and if the trauma is so significant that it is impairing their ability to truly function, then we want to address that as well. There are co-occurring facilities that can manage, and there are co-occurring outpatient providers that can manage trauma as well as addiction. So it's really going to be on a case-by-case basis, and you will figure that out through your time working with that individual. Does that answer your question, Kelsey? And the other question is, how can you help an individual who is clearly displaying signs and symptoms of trauma addiction recovery but is in denial? Again, that's going to be very individualized, because what we do for one may not work for another. If they are in denial both about the addiction and the trauma, if you are not an experienced psychologist or counselor who is trained to walk someone through a trauma, then I would suggest aligning them with a provider that is trained in doing so, because that can be very detrimental for someone if they are walking back through a trauma with someone who is not specializing in that. There are tricks and turns all over that can be a catalyst for increased substance abuse. What you could do is offer support. Be there to listen if they start throwing things out that sounds like they're testing to see the waters of, is there abuse in my past, is there not? Listen to what they have to say. When it comes to the addiction piece, provide as much information as you can regarding the substance, what the consequences of continued use could be, what could be the outcome if behaviors don't change. So we really want to make sure that we are providing them professional assistance. We can't make someone accept that they have been traumatized. All we can do is support, and we can help them walk through that process and do what we can do to not re-victimize an individual, not put them in situations that are going to trigger past events. Does that answer your question? We have another question. How do you appropriately identify the trauma in order to make sure they are being connected with the correct resources? How do you not re-victimize if you don't know what has happened to them? And that's a good question, because a lot of times we won't know what has happened to an individual. But through observing behaviors, are they resistant to meet new people? Do they display high anxiety? Do they seem to not connect with another individual? Those are some indicators that a person may have experienced some type of trauma in their past. But again, we can't make someone become accepting of their trauma. When we are looking to identify trauma in someone, this is where, with trauma-informed care, we're always looking to use the best evidence-based practice that we can, so that we have to consistently work off of the information that we do have. So with evidence-based practice, we are constantly updating, getting information, learning about this individual, and as we work with this person longer, we may have other pieces that we weren't aware of when we first began, and at that time we would need to reevaluate how we're working with that individual. All we can do is take the information that we have and provide the best care for that person with what we have, and keep that continually rolling. We always have to be open to changes in how we approach an individual, because we're going to be getting more information as we continue to build a more trusting relationship. Does that answer your question? These slides will be available up on our website. I'd say give us about, probably by next week, they will be up on the website and you'll be able to access them at that point. We have another question from Kelsey. Are there any guidelines you can suggest for use of self in practice? sharing life experiences, for example, in a professional manner. Let me see if I understand your question. Guidelines you can suggest. Okay, for use of self. That is going to depend on the type of relationship that you've established with the individual. We want to be careful not to put too much of ourselves out there. We want to keep some of our information and give them information as is needed. If you need to share an experience that you've had to help build a relationship so that person maybe feels that they can connect with you, that is certainly a practice that I have used as well as others I'm aware of. You can certainly use your situations or use your own personal experience how you see best fit. If an individual, it can become a fine line at times because you don't necessarily want to open yourself up to vulnerabilities working with an individual. But at the same time, if you need to share something, as I said, to establish that rapport, sometimes that has been needed. But in terms of any strategies or any guidelines, I would just, suggest as you're going through, if you are sharing personal experiences, and it's going to be different at every level of service as well. I know those that are in the position of certified recovery specialists, you have a more peer mentor-based relationship that will be different than someone who is in the clinical arena and doing individual therapy. You have the ability to open yourself up a little bit more in that position, but again, that's going to go with what you're comfortable with and how effective it is in establishing your relationship. Okay. I was having slow internet connection. Late to the PowerPoint. I was able to listen on the phone. Are we able to have a copy of the PowerPoint? Yes. As indicated, this PowerPoint will be up on our website probably by next week, so you'll be able to access it again at that point. Especially if you're not a clinician. What are your thoughts about the new therapies, such as EMDR? I think in the right situations with the right trained clinician, it can be effective. Again, that is not something that should be tried with an individual who's not specifically trained. That does require specific training. If you can find a therapist who has that certification and can do that type of training, then by all means, if it's something that the individual is interested in, discuss the options with them. Let them know what it talks about, what it is about, give them a brief overview of the understanding of what they would be experiencing, and let them help make the choice. What if you are not a trained clinician, for example, a case manager? Case manager, even in a case manager, I think, anyone who is attempting to work an individual through trauma who is not a trained clinician, your best way to work with that is to just support the individual, listen if they want to talk to you, align them with the best resources to help them. So there, like I mentioned earlier, there will be different roles that we will be looking for people in the community to work together. And some will have more training and certifications and able to do other arenas of trauma therapy, and others will be more of the support through the trauma and the therapy. So the best thing, case manager's role, for instance, if you have an individual who has identified or you have identified as there being possibly a concern of history of trauma and they're dealing with addiction or even trauma alone, so be their support. Be someone that can be that sounding board to help walk them through so that they know they have someone else aside from just the therapist. Make sure they have the best resources available. Know what resources are available and give them those options. Let's see, John. Question is, when working with a person new to recovery, if you uncover a suppressed trauma, What is the best way to deal with this? Again, that's going to depend on what your role is. If you are a trained clinician and this is something that you are working through, even if you are a trained clinician, but you don't have perhaps certification in one of the appropriate modalities, find a resource that is best suited to work with that individual. Myself personally, I can recall an instance where I had an individual I was working with that had a specific type of trauma I was not familiar with. In that case, I referred out to an appropriate therapist that had been trained. So you want to, when you identify that, you want to make sure that the individual is comfortable. Not everybody is ready to work through their trauma. What we can do in that case is let them know what resources are available, how they can help them, and be there as a support and a listener, and help them plan their best recovery package. Conscious actions can cause the patient to re-experience a trauma. Okay, so this question or statement says, in my experience, sometimes small action and statement can cause the patient to re-experience a trauma. Other than using de-escalation techniques, is there anything you can do to get the patient calm enough to re-engage them? In an instance like that, if you have an individual that perhaps something you've said or an action or something very small has triggered their trauma response, at that point, if you have the option of bringing in another individual to help redirect the person, get them redirected, use your de-escalation techniques, and then once they are back calm and in a rational state, sit down and engage them in a conversation to process through what it was that triggered them. You can phrase that in the terms of, you're trying to help best serve them and not cause them to go through a re-victimization. And so you were wondering what caused their anxiety, what caused them to feel panicked, what caused their symptoms of trauma, re-victimization. And when you can have that conversation, that engages two things. One, the individual knows that you truly have their best interest at heart. And two, you're able to reestablish the rapport in the relationship because they understand that it's not something that was intentionally done. Always be honest with that. Are there any more questions at this point? Did I get to everybody's question? Okay. Well, I want to thank everybody for participating today. I hope this webinar was informational for you. Again, it will be available through our website, which is www.pro-a.org. Again, that's www.pro-a.org. And if there are no further questions for today, this will conclude our webinar. I want to thank you all very much, and I hope you all have a great day.